You're pregnant. Now what? Whether you've been dreaming about it for years or it just took you by complete surprise, those two little lines on a pregnancy test can hit like a wave of joy, fear, and about 1,000 questions all at once. So what should you do in your first trimester? And maybe more importantly, what should you not do? I'm Sarah Jennings, host of the Mama Method for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. And that's exactly what we're diving into today. The first trimester, those first 13 weeks and 6 days, is one of the most critical parts of your pregnancy adventure. Even though you may not even look pregnant yet inside your body, it's like New Year's Eve at Times Square. Everything is changing. That tiny bundle of cells is forming organs, a heartbeat develops, the brain and spinal cord get their start. I remember reading that at 8 weeks, the baby is about the size of a raspberry, and I just stared at my morning smoothie, crying with joy. Ah, hormones. Speaking of hormones, let's talk symptoms. Fatigue? Don't be surprised if you feel like you've run a marathon by just folding a load of laundry. I practically lived on the couch during week 7 with my twins, Hudson and Chrissy. Doctor-approved tip. Naps are medicine. Nausea and vomiting, or as they misleadingly call it, morning sickness, affects up to 80% of pregnant people. Though I can tell you from experience, it does not care what time of day it is. If you're struggling, ginger tea, bland snacks like crackers, and frequent small meals can help. There's also that magical pressure point on your inner wrist that helps some people. Acupressure bands are a thing. And of course, if it's getting severe, don't tough it out. Reach out to your doctor. Smell aversions and food sensitivities also tend to show up around now. 1 week you're obsessed with grilled cheese, the next just the smell of it sends you fleeing the kitchen. Totally normal. As are breast tenderness, heartburn, constipation, and needing to pee every 10 minutes. Thanks, progesterone. Now let's talk about the questions I hear most often, like, what can I eat or not eat? Rule of thumb, avoid foods that are more likely to carry bacteria, raw meats, unpasteurized cheeses, and yes, sorry, sushi. And don't forget about fish. Some fish are a no-go due to mercury, like swordfish and king mackerel, but salmon? Packed with omega-3s, great for baby's brain development. Next biggie, am I supposed to be gaining weight yet? Not really. Most people gain very little in the first trimester, maybe 3-5 pounds. So don't stress if your jeans still zip. What about cramping or spotting? Mild cramps can be normal. Your uterus is stretching after all. But bleeding or persistent pain, that's a reason to call your healthcare team. About 1 in 3 pregnancies experience some spotting in the first trimester, and many go on to deliver healthy babies, but it's always best to check in. Another common one, can I still work out? Honestly, movement is great for both your mental and physical health. Just skip the high-risk, high-impact activities. Now's not the time to try hot yoga or pick up downhill skiing. Gentle walks, light strength training, or prenatal yoga are fabulous choices. And here's a fun fact. Taking a prenatal vitamin with folic acid before you even find out you're pregnant can help reduce the risk of nausea and neural tube defects. But if the full prenatal is too much during early pregnancy due to nausea, talk to your doctor. Just getting in folic acid may be enough for now. Also, hydrate, rest, and yes, give yourself grace. I officially declared my 3rd pregnancy Q for takeout night every Wednesday because cooking, not always an option. Lastly, let's talk about what to hit the brakes on. If you haven't already, stop alcohol, tobacco, and marijuana. Even secondhand smoke isn't safe during pregnancy. And remember, no amount of alcohol has been proven safe in pregnancy, especially during these crucial early weeks. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. If you found this helpful, give us a like and follow for more doctor-approved info you can trust from Ubi Health. There's so much more to come, and I'm here to walk through it with you, 1 trimester at a time.